Describe the image.
This is a clinical photograph of both hands for a patient who failed to make an OK sign on the right hand as a flexion of the interphalangeal joint of the thumb, and the DIB joint of the index finger is impaired. This sign is called Kilo-Niven sign.
What is differential diagnosis of this sign?
First, anterior interosseous nerve palsy. Second, Parsonage syndrome, which is bilateral anterior interosseous nerve syndrome caused by viral brachial neuritis. Third, Manner-Felt-Norman syndrome, rupture of the FBL tendon.
What are the muscles innervated by the A?
Muscles innervated by anterior interosseous nerve has principal motor innervation, no cutaneous sensory, and innervate three muscles: deep compartment of the forearm, which is FDB, flexor digitorum profundus of the index and middle fingers, and flexor pollicis longus and pronator quadratus.
What is Martin-Gruber anastomosis?
It is a communicating nerve branch between median nerve and ulnar nerve in the forearm. Motor fibers mainly occur in 20%. The most common locations from median nerve in proximal forearm to ulnar nerve in the middle to distal third of forearm, and from anterior interosseous nerve to ulnar nerve. Median to ulnar nerve communications in the forearm are mostly motor. However, sensory symptoms also have been described in the literature. A similar sharing of sensory fibers in the hand can exist between these two nerves, and it is called Rishi-Kani anastomosis. A median nerve lesion situated proximal to communicating branch would affect the median thenar muscles, whereas lesion below that level wouldn't.
How can you test for pronator quadratus?
By resisted forearm pronation with the elbow maximally flexed.
What are the sites of compression?
Deep head of pronator teres muscle, most common site. Flexor digitorum superficialis arcade. Gantzar muscle, accessory head of flexor pollicis longus, and edge of lacertus fibrosus.
How can you differentiate between FPL tendon rupture and A?
By passively flexing and extending the wrist to confirm tenodesis effect in intact tendon. If tendon are intact, passive wrist extension will bring thumb interphalangeal joint and index finger DIB joint to a relatively flexed position.